Hi, everyone. I'm David Williams, president of strategy consulting firm HealthBiz Group and host of the HealthBiz podcast, a weekly show where I interview top healthcare entrepreneurs about their lives and careers. So if you like this episode, make sure to hit that like button and to subscribe. My guest today is Oron Afek, co-founder and CEO of Vim. Vim connects data from health insurers and other data into existing electronic medical record workflows, helping doctors make better cost and quality decisions during patient visits. The company's backed by tens of millions from Optum, Walgreens, and other industry heavyweights, so they're clearly doing something right. I have to say, it's not the most obvious path for someone who grew up in Israel and served in the special forces there before founding telecoms, gaming, real estate, and education companies. So I'm going to be very interested in hearing Oron's own story, and I'm sure you are as well. Oron, welcome to the HealthBiz podcast.
Hey, David, thanks for having me. It's good to be here.
So let's hear about your background and upbringing. I'll say it may not be that shocking to hear that I've interviewed a number of Israelis on the show, or people who grew up in Israel. But actually, the number two location after the U.S. and then Israel is actually Tanzania. So if you have a Tanzania link in, feel free to bring it to the fore. But what was your upbringing like? What was your childhood like? And have there been childhood influences that have stayed with you through your career?
Yeah, no, thanks for asking. It's been fun childhood. Grew up in a pretty small place, not too far from Tel Aviv, but still, I would say middle class, top of area. Very simple life, mostly playing outside, no digital stuff, no computers, no technology initially. At the same time, it was a pretty heterogeneous environment where there are, certain people that you could connect with are really into school and things like that, and others that are more troublemakers. I think just getting the exposure to some hardships as a kid, at the same time to be able to surround yourself with high talent density, I thought was a good mix. And I think this will be type of environment I'm likely going to have more hard time providing for my kids.
Yeah.
Given that we live in the heart of Manhattan, or in Tel Aviv, and it's just, I think it's just harder. It's more homogeneous.
Yeah.
But I definitely had a really good experience as a kid.
No, that's good. And then, so in terms of, then you actually went to the military, as most people in Israel do. What was your military service like? Your education? I mean, what did you, some things that you sort of took away from that that informed what you did later?
Yeah, so special operations taught me a lot of things. I think that first and foremost, that discipline, or that ceremonial discipline, that thing that you kind of taking into account certain activities that you need to do, every day, every morning, and at the same time, the practice and the repetition, how your body teaches your mind and your instincts. I think those things really, have really been critical to, and big influencers of kind of, during that age, during that time. Not that I wasn't a very disciplined person, before going to the military, but I think that kind of takes it to the next level. I think, pushing the envelope on, physical and mental, challenges. I think that also really, really helped. And of course, just learning about teamwork, and how to collaborate, that's obviously critical. Like understanding that you can't do everything by yourself. You have to surround yourself with the best people and count on them, and completely delegate, or completely take on something and own it. I think that's been the most critical learning, and I've done that for a few years, and then continued in reserve service for a few more years, up until I was 35 or so. And so that's definitely been one of the most critical, I think, junctions, or factors.
Now, I was looking at your bio, describes various things that you've done, and I saw one place, I think it maybe was on your Twitter feed in your bio, and you, in addition to all the things you're doing in business and so on, I think it mentions triathlete and anthropologist. Is that are those major parts of your? I didn't see any formal training in anthropology. Is that's my My father-in-law used to say, he went to the school of hard knocks. Like, are you an actual anthropologist? Where does that come from?
Just huge passion for different cultures, languages, understanding the history. I lived in Spain for 2 years, working on a real estate company. I lived in Germany for a couple of years after a business got acquired, and it felt like uh, I can't stay like an Israeli who lives in Germany. I need to immerse myself in the local culture and experience the local foods and the discussion and the language and the lingo, which are two different things. And so I always like to see myself as a very passionate, obviously amateur anthropologist. And also I really connect with Yuval Noah Harari's writing, like *Sapiens*, and
Yeah,
those books are. I'm really passionate about that space.
that's good. I think if you read that, you're going to learn that wheat is what civilized wheat is what civilized humans, that kind of thing. So it's very interesting standpoint. I was in
Understood.
Spain too, and I was actually there in 1992. I was taking a year off between working and going to graduate school, and I was there, and of course the among other things, the 500th anniversary of the expulsion of the Jews from Spain, and they were trying to do some
Hmm.
more rapprochement, and the president of Israel was visiting, and I was trying to work on my Spanish, so I was reading the local newspapers there, and they had an interview with him, and they asked him. He says, they said like he's a Sephardic guy, so originally from family way back from Spain, and they
Hmm.
said, "Do you feel like you're like a Spanish person?" And I'm thinking, like, what a ridiculous question coming from my background, and I think it just shows actually kind of like the Spanish mentality. It's like, are you kidding me? What kind of question is that? But he answered it, in a very serious and diplomatic manner. But I think you only, I mean, Israel, I think would be the number one case in point of a place that you actually have to visit and understand and see it in order to be able to contextualize all the things that you read about it from wherever you are. But many countries are like that, and that's my Spain example.
Yeah, obviously, there's a lot of diversity there, and Israel is more, kind of single-threadly focused on, being Israeli. I think if you're
Yeah.
in Spain or in Italy, you can actually experience different cultures. It's pretty exciting.
So, after your military service, then you went on and started founding companies. Although not healthcare companies, at least from what I can say, and as I said in my intro, a lot
Yeah.
of a lot of interesting areas, but not healthcare. How did you get going from there?
Yeah, no, I think I've always been really interested in technology and how to use technology to create leverage, to create efficiencies. I've always been really passionate about that. Um, it was pretty much opportunistic, I would say. Coming from humble beginnings, the money was an interesting factor, and trying to see if I can earn money and be successful was kind of what been driving me. So I think the topic was less of an issue, and it was more opportunistically seeing an opportunity and trying to capitalize on that and trying to get it done. And I think that also, in my opinion, that period also had limited success from my standpoint, and I was also, pretty much doing things for 2 years at a time versus immersing myself for a long period of time. Uh, and at some point, money stopped becoming an issue, and the passion was not there anymore. Not, and then I think I got the realization around 2013. I need to do something that has an additional component, a critical component of doing something impactful, doing something that matters. At the same time, I also started to get into more endurance, not competitive, but just doing Ironman triathlons.
Yeah.
Did quite a few of these, and I think that this one helped me to really focus on one thing at a time. You have to be focused on one thing at a time for many many hours, and I think that also this it was really refreshing to see that if you really putting your heart and soul towards something and doing it for a long period of time and just single-threadedly focus on that, I think you can get really good results. And I was quite frankly missing that, like jumping between different ventures every 2 years, going through the same motion. With other fuel kind of fueling my mission. I think that was a problem for me. So I think the combination of looking for something that is mission driven and fulfilling and impactful together with that endurance sport that helps you to stay focused on that and just suffer
Yeah.
But with a target in mind. I think that was a life changer for me. That happened around 2013 or so.
Got it. I think I'm not a triathlete at all, but I think in the triathlon, do they have you do the swimming first? Is that what I remember? It's like so you're like because if you don't run out of
Yeah,
energy and like drown, so maybe you should have done healthcare first. I don't know if it's similar. Now, a lot of people that come from a different
it's a good one.
background, who come from like an entrepreneurial or a tech kind of background, they get into healthcare often as through some sort of personal experience. Like they encounter the healthcare system, like I cannot believe that this is what we're stuck with. Did you have any experience like that, or it was just sort of wanting to go into a more fulfilling kind of a spot?
No, actually, my experience is that I was really passionate about marketplaces. How did I discover that? I literally put a spreadsheet in place and I said, if I'd been in the place where I'm at today, and with what I know, but it was 15 years ago, what are the companies that I would be proud to be founding? And those companies were Amazon, Airbnb, a few other companies. And I was looking for the kind of the common denominator, the common thread between those companies. And I was like, those are all marketplaces. They take, inventory on one hand, they take consumers or other buyers on the other hand, and they manage supply and demand. And essentially, they also help to improve quality and lower the cost, and essentially creating some sort of a baseline to how true quality and value should look like. They use competition, they use the marketplace to surface value up. And I really like those dynamics. And I was looking for an industry where there wasn't a marketplace dynamic, that marketplace dynamic was missing. And as subsequently people were suffering, people were not getting the best value out of this. And healthcare just checked all those boxes
Yeah, I was going to
pretty
say you
amazingly. I
found
mean,
it.
yeah, exactly right. So, if you think about cost and quality variation, if you think about people following brands instead of value, if you think about fragmentation of different nodes in a network, healthcare just checks all the boxes
Yeah.
in the most amazing way. I mean, obviously, it's one of the most complex industries out there to solve for. That's why, other smarter people, tried and failed, and are still trying. So do we, but it is definitely a big marketplace opportunity.
So it's a very kind of analytical approach to say, on the one hand, you look at these companies that have done something interesting on the market side. You say, where has that not been done yet? You look at healthcare. That's great. That actually helps to explain how you could get into sort of assessing the U.S. healthcare market without having grown up in it. But then, what do you do to turn that insight into a company? I mean, where do you go from that? Because I think it's a lot of people could say there's a lot of people that are a journalist or a pundit or an academic who might say the same thing, but like, what's the next step?
Yeah, no, it's a good question. If we were Amazon, thinking about the marketplace and imagining it from scratch and start to buy one medical on one end and Truco on the other hand and try to start putting assets together, that's not the abundance of where a small startup in Israel is living at, right? And you can't really dream as big. So you need to look into that little pin that could, pinch the balloon and just blow it out, right? Just need to look for this insertion that is going to be very, very accurate and very narrow, and that took some time. I would tell. We initially started to think that the patient is actually the place where we should start. So if you can bring an amazing patient experience for even just a single line of service where there
Yeah,
is a big cost variation with low quality variation, we started to focus on imaging, MRI, CT scans, and PET scans. We said,
yeah,
let's build the most amazing experience for patients. So if they need to get their MRI or CT scan or PET scan, they would just go to our place. They go to our website or app, and they would just get the most amazing experience. They would never want to use healthcare in a different way again. And we did it. We started working with large employers like Disney. Disney was the first customer. And we connected with prior authorization systems. So we've been informed when the service got authorized for a given patient. And we've been able to reach out to the patient proactively when they were seeking for that service and show them the best facilities around them where they're going to have zero cost share. They can book the next day appointments. And the place was reviewed. There is American College of Radiology reviews and accreditations. Everything is streamlined. No bill is guaranteed. Everything, single click, get customer support. And the outcome was that nobody used that.
yeah. But so it makes so much logical sense, right? Because if you're going to go get an image, it's going to be done on 2 or 3 types of machines. But the thing is, there could be a price variation of 10x, and the correlation of the customer service and the price is probably negative, if anything. And so it seems like a real, like obvious once you analyze a place to say, hey, we can make the patient experience better. It's going to be cheaper for the payer. Someone should pay for it and it should be great. But why didn't it work?
Yeah, so everything you just described worked amazingly well. Like the interception of the intent, reach out to the patient, the experience, the digital experience on the provider side, tapping the inventory, online scheduling, everything was working really seamlessly. The only thing that didn't work is the patient behavior. As we've been talking with patients, hey, did you get this text message? Yes. Did you see the option? Yes. Why didn't you book it? Why did you end up paying $2,000 to your deductible, given that this MRI that you've done is cost $5,000? Said, because that's what my doctor told me to do.
Yeah.
And at this point, we realized that, we were relatively upstream in the care trajectory. It's, imaging is relatively upstream. We're not down the pike of a complex oncology treatment yet, or something along those lines. At the same time, people are really following doctors' advice more than anything else, more than what they can read online. Everything just getting dismissed. And that really reminded me of other experience in my life when I was a patient. It is true, like even very opinionated people that doing their research, doing their homework, they would tend to accept their physician recommendation. And today I just know it's not always true, right? It's not always necessarily the right thing to do, especially not from a financial standpoint. Everything else, to the most part, it is the right thing to do. But from a financial standpoint, providers just don't have visibility, and they're not always the most informed people in that regards. And they don't always have the incentive to know, right? So that's kind of was a big pivot for our company. And we did it around 2017, so 2 years into the company. We decided that the real decision maker in healthcare is the doctor. We should be facing them at the point of care when they're making the decision inside their workflow.
That's very
So that was a
interesting.
big pivot for us.
I've been in healthcare a long time, and there've been some discussions about, how the way the physicians do referrals. They refer to people they're comfortable with, that they know, they have their list, they, use maybe who they went to med school with. They've heard good things about this place, and it's not very scientific. And so sometimes, the solutions say, hey, well, tell the physician like how much things cost in different places, and then, have them take cost into account. And on the one hand, if you do that, it sounds great. On the other hand, it's sort of simplistic, and it's like, whoa, I know what sort of information is out there. And I actually really don't want the physician to take that into account, because I think they may be a very good doctor, but they're probably going to be terrible at I actually don't want them to be influenced by cost. So I think some early ideas, like what you're describing, have gone down, even though they had a good insight, have actually been pretty negative. So I'm interested to hear about, which direction you've actually taken it once you had that insight.
Yeah, absolutely. So as we've been transitioning toward facing the physician at the point of decision making, we also transitioned the customer base to be payers, not employers. Payers have a lot of data. It's more longitudinal in nature. It's not just focused on the one sliver of membership in a given geography. It's focused on a bigger membership portion and many years of data and claims that can present some sort of a picture of who is performing, who is underperforming, what's going to cost what in an episode level basis. So we've really been interested in those data sets, and the incentives were really on the payer side, pretty aligned with what we're trying to do. And so we went and do it. And the problem was not the interest of the payers to participate. It was not the interest for the provider to participate. I think in value-based arrangements, where the payers were, signing agreements with providers that we've been working with, there was alignment of interest to really do the right thing and create more financial and quality sustainable treatment path. We've been also at the same time as we've been looking into cost data, we've been looking into quality data and utilization data, and the right fit sometimes is just pretty amazing from a quality standpoint. Just finding the right person for the right procedure is and reducing the times in which you're going to be seeking care across multiple different physicians. That's a game changer. And the last thing is from sheer utilization or intensity of care, quality of care. it's enough for you to steer away from the bottom 5%
Yeah.
from a performance standpoint to really improve quality dramatically. If you remember Arnie Milstein's research with Las Vegas with some folks there, that's really about the top, but the bottom 5% that creates a lot of the excess cost. And if you can steer away from there, you win. And then everything else should be just finding the right fit for the patient. So provider really liked that concept. Payers subscribed to that concept. The problem here was more technical in nature. The problem was that regular interoperability interfaces like Fire, HL7 were not just yet, and not even today, developed enough to enable the level of engagement upstream enough that we were interested in achieving. Because to the most part, it was mostly downstream. Like after the object of the referral was created, you can maybe try to insert something, change something. It was really hard to take over the workflow as upstream as it was needed to really influence the decision. And physicians are busy enough; they don't want to go through double action and just do another manual handling of something that got processed. That was a big, kind of point for us to say it's really not working with
Yeah.
this current infrastructure. And it was a big, and to make it work, you need to invest a lot of money, and you're likely only looking for larger provider organizations where you can justify your investment, and then you end up working with very large hospital systems, and their tendency to really steer and drive value is also
Yeah.
in conjunction with their investment in capex and their big,
Yeah,
facilities and their invest.
if you just do that, you're back where you were before of doing something that's actually not going to be ultimately that fulfilling, and you're not going to actually solve
Yeah,
problems that you care about solving in the end of the day.
100%. And that it was early COVID, and we said we need to be a big change here, and we need to really think about the strategy. And we actually are passionate about the small medium practices, the independent practices, the small provider organizations,
Yeah.
the medical groups. That's where the impact is. That's where we need to be focused on. So that's where the team in Tel Aviv really set up on, kind of the endeavor of rebuilding the way that we integrate with EHRs and leveraging different elements like, deep integration, computer vision, some other elements that do allow us to integrate with those clinical workflows from the outside without relying on existing APIs and other methods like
Yeah.
HL7 and Fire. It really made a huge difference. Obviously, coming from different technical military backgrounds, those people being able to bring those different disciplines. So, for
Hmm.
example, think about countries like Israel buying platforms like aircrafts, different platforms that have been built on the 80s and 90s, and they're
Yeah.
running on legacy software. How do you integrate with them modern day software technologies such as like target designation or tracking or connectivity, real time decision support? How do you do that, right? And those legacy systems don't necessarily have the APIs and the capabilities
No.
they can just plug and play. So it's pretty similar to EHRs to the most part.
Yeah.
So bringing those disciplines to the table, and then almost 2 years after, and around 5 different patents that we filed, and some of them been already granted, and the system takes seconds to install on a given EHR. It works on most ambulatory EHRs, and it's not limited to the constraints in workflows where you're going to be limited using HL7 or Spotify or some other interface like that. So this really gives us ultimate freedom to operate and to innovate inside the workflow. We are doing a lot more than just referral guidance today. We are deep into HEDIS care gaps and diagnosis gaps and prior authorization, eligibility, and so we pretty much branched out above and beyond just referrals, even though referral still stays a very big focal area for us. But that definitely was a huge change that really helped to grow the company and make a significant impact.
Got it. So I was thinking about, what the connection is here, and I was thinking like, what is as expensive and complicated as a U.S. healthcare and the IT infrastructure? And I suppose like retrofitting an F-16 to be able to use it in 2022 would qualify. I hadn't thought about it that way. But I want to come back to what you said about, when you're looking at the whole system and you're saying, okay, Amazon would do this, bring assets together, and you're going to find that place that you can sort of like, just like prick the balloon and do something. And the imaging application sounded like that. But what you're talking about here and saying, look, interoperability is not really working. All these standards, Smart on Fire and so on, aren't sufficient. We're going to go do something ourselves, and we're going to get into the workflow of all these physicians. I mean, is that following the pinprick model, or are you going something that's like very broad and expansive and overreach?
It is following the same model, and I say how. Obviously, it's a huge pivot, it's a huge deviation. It's not how we started. It cost us $100 million of burning through venture capital funds to get to this point. And we're lucky to have amazing partners. You mentioned some of them: Sequoia, Anthem, Great Point Ventures, Walgreens, Florida Blue, others. It's been a really amazing journey. And the way that we're thinking about the world today, we should not be the one building all the innovation on the platform. So for me, building specific steerage applications, for example, to find the right imaging service and so on and so forth, this could be something that someone else is going to be built on top of our platform. What we are really focused today is that just building those rails, building that, using the Amazon example, building the AWS, not necessarily the websites that run on AWS, and be really, really focused on just building that enabling infrastructure, because we think that and similar to what Apple done, right? If you think about the iPhone, if you think about things like Uber and many different applications, they wouldn't be in existence without the iPhone. The iPhone was the enabling infrastructure to many different marketplaces connecting different people that wasn't available before that. So how do we enable those using technology, enabling those other companies that gonna come in and innovate? So we're not trying to boil the ocean and build everything ourselves right now. We are really focused on enabling other companies that are in the prior auth space, are in the steerage space, are in the pharmacy space, to build their application, to deploy their applications in the point of care. So to much extent, Vim has become a workflow integration company, and we're really proud of that.
Great. Okay. So, you mentioned something there a little bit about some of these independent providers. And on the one hand, everybody's heard about these very large health systems, so-called integrated delivery networks that are not actually so integrated. A lot of them are just big amalgamations of providers. And the main thing that they do well is to have enough bulk to be able to negotiate with the insurance companies. So they don't really solve the clinical integration problem, even though, they make some moves toward doing that. Say a little bit more about independent providers, what you see is the importance of those players, and how, what you're doing might actually perhaps enable them to be successful and not just get swallowed up in the long term.
Mm-hmm. Yeah, I think there are three segments in the market. Two of them we're really interested in. One is the pure independents, the small practice, the 1D, 2Zs, 20, 30 doc practice. Definitely very interested in those guys. And then there's medical groups that are not hospital affiliated. Some of them are more sophisticated, PE-backed, Privia, and so on and so forth. Definitely very interesting segments. I would say one in a second. And then you have the larger IDNs, as you mentioned, David, where I think there's the potential to change and drive true value and value-based care, given all the CapEx investment they've been doing before, is more limited. Some of them are very innovative. They're very progress thinking. They are changing, and they will continue to change. But it is a harder, slower motion. And so what I like in the first two segments is that their tendency to be nimble, given that they don't have those legacy investments in a lot of capital they've been investing in. Their ability to be nimble, to change, to drive workflow changes, to drive practice changes, to take on more risk is a lot bigger. Their appetite is a lot bigger than those larger, very expensive systems. And that's why we're so interested in that. And those folks also maybe are less, have less engineers on staff and are more beholden to their EHR vendors to make every small change. So their tendency to be less, to be more innovative is limited. It's sheer ability to innovate and create things inside their workflow that really stop them from getting to value-based care. So for us to focus on those folks, getting data from the large payers we work with into those workflows, create some sort of a harmony and collaboration, that's really been a focus for us.
Great. That's a great That's a great explanation. So although I have many more questions in this vein and we could continue on, I think we may be best served by having maybe a follow-up podcast in a year or so to see how things are going. So I just want to finish by asking a question I ask all of my guests, which is, have you had a chance to read any good books lately? Anything you recommend? And I guess anything you would recommend that we avoid?
Absolutely. So we mentioned Yuval Noah Harari. I did not read it recently. I've been reading it as soon as those books came out to the market. So, if you haven't read them, then definitely, I mean, you obviously read, but,
Yeah.
if others, that's a huge recommendation. I'm currently reading Speed and Scale by John Doerr.
Mm-hmm.
Climate is something I'm very passionate about. I'm vegan for many years now. I'm a big environment enthusiast, and I think that at some point I also try to do something in that space with the team that we have here at Vim, and I think it's an amazing book. Everyone should read it.
Great. Well, Oron Afek, CEO and co-founder of Vim, thank you very much for joining me today on the HealthBiz podcast.
Thanks a lot, David.
You've been listening to the HealthBiz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.